From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Colorado health officials are watching with concern as measles cases increase around the country. Outbreaks of the highly contagious disease are on the rise in about 24 states. Most of the 800 cases so far are in Texas. But Colorado health officials have confirmed 3 cases here in the state, and they're warning about measles spreading. So how do we prevent that from happening here?
Measles is entirely preventable with vaccines. The measles vaccine is so important for your health and your child's health.
That's Dr. David Higgins. He's a pediatrician and preventive medicine specialist at the University of Colorado Anschutz Medical Campus. And he says healthcare workers in the state should push to get more people vaccinated against measles right now.
Measles is one of the most contagious diseases that we know of. So if a person has measles, up to 9 out of 10 of the unvaccinated people close to them will also become infected. It's spread through droplets, such as when you get close to somebody else and you're speaking to them or you sneeze or cough, and it's also airborne. It can linger in the air for up to 2 hours after an infected person leaves the room, so you don't even need to be in the same place at the same time to catch it.
What are the key symptoms that we should be looking out for here?
Yeah, so measles usually starts with what looks like a bad cold. High fever, cough, runny nose, and red, watery eyes. One early clue that's unique to measles are tiny white spots inside the mouth called Koplik spots, but those can be difficult to recognize. After a few days, a red blotchy rash appears that usually starts on the face and spreads down to the rest of the body.
And as a pediatrician, how often do you see cases of measles in your clinic?
Yeah, so I've never seen a case of measles in my own practice. For years, even decades, measles has been so well controlled in the U.S. thanks to vaccines that most pediatricians of my generation have never had to treat it. But now with vaccination gaps widening, I am wondering when one of my own patients is going to get it.
What makes infection with measles so serious? And what are the possible long-term impacts of contracting measles?
Yeah, what many people don't realize is how dangerous measles can be. It is more than just a rash and a fever. Complications like pneumonia, brain swelling, and unfortunately, as we've seen recently in Texas and New Mexico, even death can occur. These complications are more common in vulnerable people, including those who are unvaccinated, young children, pregnant women, or individuals who are immunocompromised.
So the single best tool for preventing measles is the MMR vaccine. That's measles, mumps, and rubella. Help us understand how effective immunization has been in getting measles under control in the U.S.
The measles vaccine is incredibly effective. Every single measles case, every outbreak, complication, and death is entirely preventable because the vaccine is so effective. And it's been around for a long time, for over 60 years. But when vaccination rates fall, it's not a matter of if an outbreak will occur in a community, it's a matter of when, because measles is only a plane flight away.
When you look at vaccination rates across Colorado compared to Texas, which is experiencing the majority of measles cases right now, what does that data tell you about the threat of a larger outbreak happening here?
We are below the 95% threshold that we often talk about that's needed for community immunity. Every imported measles case, every traveler who either enters or returns to Colorado with measles enters a patchwork of local communities where vaccination rates aren't high enough. So even if our state rate is high, sometimes there are communities, schools, organizations, places where people gather where the rate's extremely low. We often see lower vaccination rates in areas that have access problems to vaccines. Sometimes that's in our more rural areas where they may not have great access to a vaccine provider, whether that's their doctor or somebody else.
They might have to drive very long distances, for example.
Exactly. And even in our larger cities, sometimes parents have a difficult time getting in to see a healthcare provider and get their children vaccinated. Or they have concerns. and they have questions about vaccines.
Colorado collects immunization data from schools. Is there a magic number here? How low do vaccination rates need to drop in a school district or a community before it becomes worrisome?
Yeah, so we often talk about the 95% vaccination threshold that's needed for community immunity, meaning at that level, we don't expect measles, if a case comes into that community, to spread throughout the community. However, more is better. So if I see a school or a community that has a very low rate, under 80%, I am even more concerned that an outbreak will occur, and quickly, if a measles case comes into our state.
One thing that you are pushing for is to get people who haven't gotten vaccinated against measles or to have their children vaccinated to take this seriously. What kinds of conversations are you having with parents and families?
So when I have a parent who has questions or concerns about the MMR vaccine, it is so important that I listen to their concerns and questions with empathy, that I understand and acknowledge that they really want what's best for their child's health.
Sure.
And then effectively share with them why MMR vaccines are so important to keeping them healthy, their child, and their neighbors, their family, and their communities healthy.
You have also talked about a need for community leaders rather than state officials to push for vaccination.
Yeah.
What's an example of a kind of trusted community messenger here that you're talking about?
Yeah, so this is somebody who has the rapport and trust of the community. That might be a religious leader. That might be a community leader, such as a government official or leader. And sometimes they are simply people in the community that others look up to for guidance. Sometimes that's a healthcare professional. Sometimes it's not.
If you had to guess, do you think we'll see more cases in Colorado? And are health officials prepared?
Yes. I have a lot of respect for, and I'm encouraged by, our state and local public health leaders in some of the responses they've already had to improving our MMR vaccination rate and preparing for or responding to outbreaks. We will see more cases in Colorado. And I say that because, again, measles is only a plane flight away. And measles around the world has been surging. And Colorado is a great place to travel and visit.
True.
And people will continue to come in our state and potentially bring measles.
Dr. David Higgins is a pediatrician and preventive medicine specialist with the CU Anschutz Medical Campus. By the way, he mentioned that some healthcare workers and other adults may benefit from an MMR booster shot, even if they've been vaccinated. Talk to your doctor if you have questions about it. We'll have more information in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thank you so much for listening.